In the next couple of slides, I would like to talk about two lung diseases, namely emphysema and lung cancer. Both of them are smoking related, and I would simply like to give you an overview over these two diseases. Emphysema, which is also known as chronic obstructive pulmonary disease, is worldwide relatively common. It's 5% of the population are affected by it, and in 2013 almost 3 million people died of it. What does this mean? Chronic means it's a worsening over a long time. Obstructive means that something is blocked. In this case, breathing becomes difficult because of inefficient gas exchange, and pulmonary refers to the lungs. And there are over here, there's a picture with a healthy, normal lungs, and you can see over here that the alveoli, the air sacs, are surrounded by many, of course, walls. And in between these walls over here, I'm just going to circle this over here, these are blood capillaries, which are important for gas exchange. And you can see that there's a large surface area for gas exchange, which is possible. Now, people who smoke sometimes will get emphysema. In this case, these walls over here, I'm just going to draw over it, these walls start between the alveoli, they start to break down. And when that happens, then let's look over here on the right side. Then you can see that these alveoli become larger, and the blood capillaries over here are still there, but there is generally much less surface area for gas exchange to take place. And as the text over here says, the walls of the alveoli are destroyed, forming fewer but larger alveoli, and this significantly reduces the surface area for gas exchange. So in an extreme case, what this means is that the people who breathe, ventilate normally, will not receive enough oxygen, and therefore will feel tired and will have other problems as well. So, what causes this, and how does this actually? Why does this happen? Let's move over to the next foil. The causes for emphysema are mostly smoking, but also air pollution can be a case, dust, especially when people work in environments for a long time where it's very dusty, certain chemicals, fumes, and of course might also be a genetic predisposition. Not everyone gets disease like emphysema equally. It's a question also of the person's DNA. So, how does now smoking damage the alveoli? First of all, you have to know that in your respiratory system is lined by many so-called cilia, and these cilia are microscopic hair. And these cilia are important for moving the mucus out of the airways. So I'm going to draw over here, let's say, the trachea or the bronchi, and there are microscopic little cilia lining the airway, and there is a layer of mucus on top of that. And this layer of mucus is important because it traps dust, bacteria, whatever, and these cilia move to move the mucus up out to the mouth so that it can be swallowed, and then it's basically your airways are cleaned. But now if smoking destroys these cilia, then the mucus can also not be moved out, and mucus starts to build up, and this can result in this typical smoker's cough, where the people have are coughing very hollowly because they have problems removing the mucus. And when the mucus, with all the bacteria and the dirt and the dust, when they stay in the airways, then this can increase now the risks for infections. And the white blood cells also become damaged by smoke. They want to remove these bacteria that grow there, but they themselves become damaged. And as a response, what happens is that an enzyme called trypsin is released by the white blood cells and the damaged tissue cells of the airways. And this trypsin now is responsible for breaking down the walls of the alveoli. So it is essentially the body starts to, if you want to say it like that, almost destroy itself, or the alveoli will start to break down because of this trypsin, which is secreted. And then you have less surface area for oxygen take-up. So if this is supposed to be my alveolus, then a normal one with all of the walls, and the trypsin will then cause a breakdown of these walls in here, and you have a larger alveolus with lower surface area. And over here you can see some of these problems. That's a cross-section of a lung. So that is emphysema. Let's move on now to the next smoking-related disease, which is lung cancer. And it's, according to my research, it's the most common cancer. In women, it's the 5th most common cancer. It's more common than breast cancer. Unfortunately, lung cancer is difficult to treat because when it is discovered, it's often too late and therefore in many cases lethal. It is too late because by the time it's discovered, so-called secondary tumors, also known as metastasis, will have already formed. Now the question is, what is that? What is metastasis? Metastasis, you have in your lung a primary tumor, and cells start to reproduce uncontrolled when you in this tumor. But as the tumor progresses, individual cells will start to break loose. So I'm going to draw this. It should be that is my tumor. And individual cells will start to break loose, and over the blood, they will be transported to the rest of the body, and they will settle down in the rest of the body, and it will form secondary tumors. So, and these secondary tumors are now, there can be many of them, start to form all over the body. And then you not only have one tumor in your lungs, but basically all over the place. And that's, of course, even more difficult to treat, because you cannot operate, I don't know, tens of smaller tumors, or hundreds even. So 90% of the lung cancer cases are related to tobacco use. So the remaining 10% I can imagine are related to other issues which are mentioned over here, like air pollution. Radon gas is a radioactive gas which occurs naturally, but is emitted in certain regions of the world. And asbestos and silica can also contribute to lung cancer. Asbestos was used in construction. It was used in the construction of certain buildings. And people who worked in companies that made asbestos had an increased risk of lung cancer. So in some countries, asbestos is not permitted right now, and they try to do away with that. Now, what are some consequences of lung cancer? Well, of course, breathing problems, coughing, including the coughing up of blood, fatigue, which is tiredness, because I can also imagine that gas exchange is not happening very well, so the people do not get enough oxygen. Chest pain, loss of appetite, and loss of weight. So, what you remember here, lung cancer in most cases is a very preventable disease, as it is to 90% smoking related. So, that's basically it. This was a short overview over emphysema and lung cancer. Yes, and I did not talk about how smoking actually impacts the so-called cardiovascular system, the heart and the blood vessels. That's again a different issue because that is also an additional problem of smoking.